Now, anytime you use medicine in pregnancy, there's some risk involved in that, okay? So some people think, you know, the risk is higher when the brain is developing in the first trimester. Maybe, okay, and I don't know that you can say that there's no risk for sure in the third trimester. So anytime there's a decision about treating a woman with medication while she's pregnant or while she's breastfeeding, those are risks. You have to really weigh the pros and cons of that before you do it. So, and same thing with the breastfeeding, like I mentioned. A lot of the medicines will go through through the breast milk into the baby, and you might want to. The doctors a lot of times will advise the woman to bottle feed, and again, it gets into a risk benefit. You know, how much advantage do you get from the breastfeeding versus you know, the disadvantage of if you don't treat the woman and she gets depressed. You know, what's better or worse for the baby? Those are tough decisions. You know, I've been there. Those are kind of hard decisions. Typically, this is something medications is required for. Psychotherapy can help, and I always recommend psychotherapy, certainly to help with the bonding of the infant and you know, with some of the stress that's involved in becoming a new mother. But the medications usually are necessary for that. So the outcome, what's the outcome of this case? Psychiatry was consulted when the patient was still in the hospital, and because the OB/GYN physician recognized that the patient was getting postpartum depression and was really concerned about it. The patient was treated immediately with an antidepressant and an antipsychotic medication and psychotherapy to help her bond with her infant once the psychosis cleared. She improved in her mood and psychosis and remained on the antidepressant and did okay. So that's postpartum depression. There was some interest in postpartum depression. If there's any questions about postpartum depression at all? Yeah?
Prior to, if the mother has experienced depression teenage years,
okay,
menstrual cycles coming, got that 13, 14, 15-year-old, she ends up pregnant. She's on her antidepressants when she's 3 months along, okay, because she's had all this trouble here. Isn't that a form of postpartum? The doctor keeps her on her antidepressants because of all the age level, maturity level, what this young teenage mom's going through. Boom, you have big hormonal change to give birth to a baby.
Yeah.
So they weigh the risk of that young mom that's facing all these things, keep her on her medication, because I've worked with several teens that are currently on Prozac, currently on different medicines. They did not take them off during pregnancy.
Yes, I mean, sometimes you definitely leave a person, a woman on.
I thought you were saying they would prefer to take them off. So
you're talking about a little different situation. So you're talking, I think, now correct me if I'm wrong, you're talking about a young girl who is treated with an antidepressant for depression,
right,
before any pregnancies or anything.
Yes.
So she's had depression independent of the hormonal stuff, right?
Right.
So this is a little different because she could become depressed at any time. We can't really trace it to hormone change.
Okay,
so
a mother that's 25, 28, still same scenario. So the age barriers are no different. Mom's been on, she's had some problems, she ends up pregnant. They take her off that depressant?
Some doctors will take a person off, take the woman off of the antidepressant, but I guess the key is that hopefully you have a doctor that's seen you for a while and has seen you through the depressions. And if you've seen somebody through a depression and it's been a pretty severe depression, yeah, I mean that's what it's all risk and benefit. So what you do is you talk to the person, you say, look, Sally, or I always keep using Sally, I don't know why, but Sally, as your physician, I got to tell you that you've had 2 episodes of depression before, and they were both pretty serious episodes of depression. And we've decided to keep you on medicine all this time. Now you're pregnant, and yeah, the medicine could affect the baby. We think that it's fairly safe, but sometimes you don't know these things. You can't say something's 100% safe. So we have to weigh the risk of taking you off the medicine to protect the baby, and then you getting very depressed again. And sometimes, incidentally, one thing I haven't discussed in this talk, but I did before in depression, is the more times you get depressed, the more episodes you have, the worse each one is. So that you really, she's had 2 already. The third one may be a humdinger. So do you want her to get depressed while she's pregnant? You have to have that discussion with her and with, if she's a minor, with her mother, and you all sort of make it as a team decision. And but it's a little different than postpartum depression, because you see how it's different, because she had depression already.
So there was the
existing depression, and
we just take her off of it. We deliver baby, we go right back on our medication because she's in full postpartum.
Yeah, that's one option. And actually, there's no textbook for
Can
this.
last up to 2 years after the birth of the baby, is that correct?
Can the depression last for up to 2 years? Yes. I mean, an untreated depression can last, any depressive episode that's untreated can last up to 2 years on average without any treatment, which is why you want to treat it.
So mom gives birth to baby,
Yeah.
medicated for postpartum, goes into the full case there, okay? Can get pregnant 6 months later, give birth again, and go back into postpartum.
Yes. Yeah, postpartum, once you've had one episode of postpartum, it's kind of likely you're going to have another one. Not 100%, but it's pretty high. So, these are details. I guess these are tough things to, you have to decide these things on a case-by-case basis. That's the hard part. Because you have to consider all the risks and benefits of each individual case, and no two cases are exactly the same. So that's what's hard about it. In general, if they've had a very severe depression and it's independent of the hormonal, it's not a postpartum depression, it's independent, you need to think real hard about whether you keep them on antidepressants during pregnancy or not. And that's a risk. We used to say that the newer antidepressants are very safe, and now there's some brand new data that just came out with Paxil showing that there may be some issues there. So, it's hard to know with the studies and the way they do these things. Believe me, I know firsthand now, after being a clinician on the one side and then going into the pharmaceutical companies, you see both sides of it. When you're a physician, you criticize the pharmaceutical company. When you're a pharmaceutical company person, now you see sort of what they're up against. It's difficult. A lot of ethical things. You can't. We certainly couldn't do a study where we signed up a bunch of pregnant women and said, here, we want to expose you to this medicine and see what happens to your baby. You can't do that, right? So all you have to go on is sort of accidental exposures. Women who have been exposed, now what happens? And that's really not the best way to collect data. You don't collect very good information when you do that. So, does that answer your question okay, all those? Okay. Any other questions? Not a lot of time left, but let's talk real quick about premenstrual dysphoric disorder. Case example, this is a young female who has who has normal mood and functions well a few weeks a month. But about a week before having her menstrual period each month, she starts to feel poorly about herself, has low self-esteem, becomes anxious, is moody, gets angry quickly, loses interest in work, which she normally enjoys. Can't concentrate, has pretty low energy level. She craves sweets, has bloating and breast tenderness. These symptoms cause her to miss work a few days a month, and she's at risk of losing her job. But the symptoms always lift a few days after starting her period. So this is not a classic major depressive episode that starts, gradually gets worse, and keeps going until you treat it. This is something that is a weekish. It could be a little longer, a little shorter before the menstrual period, and then once the menstrual period occurs, it lifts. Again, think about it for a second. That has to be hormonal, right? It has to have something to do with the female hormones and the fluctuations therein. So really, that's the definition. That's how you define it. That's how you know what it is, because it meets these criteria I'll talk about in a second for a depressed episode, but it occurs only these times, and it lifts right with the menstrual period. The symptoms are pretty much the same as a depressive episode. Some of the things that are a little different, I suppose. Not so different, I guess, but the feeling bad about oneself, that happens with depression anyway, so that's one. Sudden mood changes. Sometimes the person's mood will, they'll be very irritable one minute, and they'll be depressed the next minute, maybe feel okay for a little while. Anger and irritability problems with the relationship.